When it comes to post-operative pain relief, is there a best buy combination of analgesics?
Yes and no. Obviously, I mean, it depends on the type of surgery a little bit, and also on your individual patient. I mean, pain is very individual, so you need to always have an individual approach. But whenever you can use a regional approach, or whenever you can block a nerve that innervates the area of interest, you should probably go for that. Personally, I use the WHO top-down approach, where I usually add strong opioids in the immediate post-operative period, but usually at a slightly lower dose than I would have used in the past. And then I add obviously non-opioids because of the opioid sparing effect that has been well established and shown. And from there on, I'm trying to taper down the opioids first. Hopefully I can have my patients well controlled with the pain with just a regional approach if there's a catheter in place, plus non-opioids. And then eventually the regional approach or the catheter needs to come out, and hopefully at that time patients can be managed without any opioids, and only non-opioids are being given.
And another question, is there a place for transdermal fentanyl in perioperative analgesia? I know that some centers have used it in this way.
It would not be my first choice, really, because the kinetic is just so slow. I mean, you put it on, and after so many hours, you might have an effect or not. There's the additional disadvantage of the drug uptake depends upon skin perfusion. It's not uncommon for patients to get a little hypothermia during surgery, but at the same time we sometimes apply forced air warming, which kind of might cause hyperemia and hyperperfusion of that particular area. So the uptake might be higher than you would expect it to be. So this is not a great choice for post-operative pain management, where you sometimes also have peak pain episodes when the patient starts moving around. How are you going to control for that with transdermal approach? I know that some surgeons have used that in the past, but it's really not. It's not a great approach because it's just too slow. And this is more approach for chronic pain patients that are usually at a steady level of chronic pain. But for postoperative pain, I would say that's a no-go.
That's very helpful. So is multimodal analgesia now the standard of care for post-operative pain relief?
I really think it is. I mean, those are drugs we have decades of clinical experience with, right? If you talk about acetaminophen or ibuprofen, they are available as IV formulations now, which makes it a lot easier for us to use in the immediate perioperative period with guaranteed onset of action at the chosen time point. I think if you're still using an opioid only based post-operative pain management approach, you're a dinosaur, I think.
And my last question, what do you say to patients about multimodal pain relief?
I usually try to explain it like that. If you're hungry, you can fill yourself up with potatoes or rice only. But if you kind of add a little ingredient here and there, you can be filled up too, but it tastes a lot better. So, and that's something patients usually understand really well. So trying to, take a little bit of this and take a little bit of that, obviously everything, evidence-based, and, there are studies out there to support that. But at the end, the meal tastes a lot better. We still have the same common goal, which is, well-controlled pain management.
Dr. Tzabazis, thank you very much for sharing your expertise on post-operative analgesia. That was very interesting. For more information on the work of Dr. Tzabazis, please visit our website using the link in the description. Be sure to sign up for more videos, news, and journals. For updates straight to your inbox, please follow the link below. And as always, thanks for watching.